Why health insurance matters, coverage matters, NCBI book shelf. Why health insurance matters, publication details. The Institute of Medicine IOM commentary on the consequences of universal of insurance. Insurance launched an extended examination of evidence that address the importance of health insurance coverage. With the publication of this report, coverage matters is the first in a series of six reporting that will be associated over the next 2 years, documenting the reality and consequence of having an estimated for 40 million people in the United States without health insurance coverage. These reports will examine the implications of lacking health insurance for those without their families, for communities in which a substantial number of people are uninsured, and for this country as a whole. The committee will look at whether, where, and how the health and financial burdens of having a large uninsured population are felt, taking a broad perspective and a multidisciplinary approach to these questions. To a great extent, the cost and consequences of uninsured and unstable insured population are hidden and difficult to measure. Financial cost incurred by those without coverage may be covered by payments for the health care of those with insurance are paid by critics and taxpayers, and the health effects may be absorbed by families in the form of diminished physical and physiological well-being, productivity, and income. The goal of this series of student study is to refocus policy attention on a longest standing problems following the longest economic expansion in American history in 1999. An essentials estimated one out of every six Americans, 32 million adults under the age of 65, and more than 10 million children remains uninsured. Miles 200 a better understanding of the consequence of existing po- policies and healthcare financing arrangements should regulate discussions of the issues of coverage and better equip us design and evaluate policy in initiatives and proposed from instead to address this problem. The community's charge is to communicate to the public and policy maker analytic finding about the meaning of a large uninsured population for individual individual families and their communities, as well as for society as a whole. Its reports should contribute to the public debate about insurance reforms and healthcare financing by assessing the theoretical and empirical empirical research in health service, medicine, epidemiology, and anonymous that bear on the effects of lacking health insurance. It is not within the scope of this project to develop or advocate for a specific set of reforms or policies.